made the brochure, we decided we wanted potential patients to actually see our staff so that when they would come in for care, these faces would be familiar. So these are all our own staff. This flyer that's done in Spanish is also all of our own staff. And like Yvonne was talking about earlier, we have reception staff, we have outreach staff who speak Spanish. And all of these providers, these aren't all of our staff that speak Spanish, but all of the people in these pictures do speak Spanish. So we have Dr. Sudbarg, who's a family medicine physician, speaks Spanish. Dr. Jenna Putzel, who is a pediatrician who sees kids, she speaks Spanish. Dr. Melissa Marshall, who's a family medicine physician, she and Dr. Sudbarg both do OB care and deliver babies. They both speak Spanish. Sarah is one of our outreach community health nurses. She actually goes out in the community and goes into homes. She speaks Spanish. Down here we have one of our dentists who speaks Spanish, Rachel Phillips, who's one of our family medicine nurse practitioners who speaks Spanish. And this is Dr. Dan Berg, who's one of our new physicians. He's internal medicine. He's from St. Louis, went to school at WashU. He also speaks Spanish. And this is his assistant, Linda, who formerly worked, was a medical assistant at La Clinica, who came to us when La Clinica closed. She speaks Spanish. So we pride ourselves on having lots of staff who can speak Spanish. Again, like Yvonne said, we have a number of other staff who don't. We rely on LAMP to come in and do the translation. But it's worked really well, and we're very proud. Our number of Hispanic patients has grown significantly since the closing of La Clinica. And at last count, we have about 1,600 active patients who have actually been to our health center in the last year. That's what we call active, who have Spanish as their first language. And we feel like we can continue to meet the demand for that. Certainly I can't speak for Yvonne, but you know, our health center is looking at capacity issues. We have a lot more people wanting to come to our health center to access care, and we have providers to provide those services. And we hope that through healthcare reform that changes, that we're able to grow and add more providers and add new facilities so that we can meet the needs of all folks who are going to have affordable access to healthcare insurance. I was trying to look. A couple of other questions that Adelia asked us to talk about. Family Care has a couple of evenings and also Saturday hours. So especially for people who are working, we want to try to accommodate them. So we do have evening hours. We do have, like Grace Hill, we also have mental health services on site. We have a psychiatrist, a child psychologist, and some licensed clinical social workers. I think that one of the questions about do we have plans for future expansion, I think most all of the health centers were all included in healthcare reform. So I think you're going to see all of us trying strategically to expand within the St. Louis area to serve as many new patients as we possibly can. And another thing I think that probably we do want to underscore is our mission really is focused on underserved populations and people who ordinarily wouldn't have access to a doctor or a dentist. We're happy to take people who have private insurance, and we probably have 9 or 10% of our patients who do have private insurance who come to us. We're grateful for that, but our focus is on people who don't have insurance and people who have Medicaid in particular. And the people who don't have insurance, we charge on a sliding fee basis, and that's based upon their family size and their income. And 80% of our patients who are on sliding fee qualify for the minimal pay. And right now at Family Care, that minimal pay is $15 a visit to see the physician. So you may generate some questions, but I'll turn that.
Okay, that's great presentation. And please notice if there is any difference between one or the other, because that will be a question at the end. And now we have the newest on the block is Dr. Gregorio Sicard with Casa de Salud.
Yeah, thank you. Thank you for inviting me. This is the first time I've had the privilege here to come here and hope to get to know a lot of you. I am going to not state my age, but I will say that I came to San Luis in 1960. So I guess you guys could figure out that I'm an old dinosaur. But I've been in this community for a long time. I went to medical school. I'm originally from Puerto Rico, went to medical school in Puerto Rico and returned back to San Luis after going through finishing high school and college here. I'm a surgeon. I work at Washington University at Barnes Hospital, and became friends through different ways with Robert Fox, with Bob Fox, that a lot of you know, who's a leader in the community. And he asked me close to about a year ago about his vision about opening or expanding some of the access to the Hispanic immigrant community. I was aware of La Clinica, knew a lot of the physicians that work at La Clinica through my medical activities, but never personally had worked at La Clinica. Being a vascular surgeon, my needs were very limited, but I did respond on occasion to some of the physicians that work at La Clinica that needed some surgical assistance in some of their patients. I accepted the challenge from Bob Fox to become medical director, along with the help of Marcos Rostein, who's from Venezuela and is a nephrologist here locally, and Dr. Fogarty, who's an endocrinologist, retired endocrinologist from St. Louis University, with the concept of trying to put together the Casa de Salud. And I think obviously we felt that there was still a void in the care of the Hispanic immigrants. We're not federally qualified health center, but I think our mission is not to compete with a federally qualified health center, but it's totally the opposite. It's actually to become as an entry point for episodic health care, and through provide then referrals to the federally qualified health center. We do not have all the services that are present in the federally qualified health care, either Grace Hill or the other healthcare facilities. So we don't do pediatrics, dental, ophthalmologic care. But we have increasingly grown the number of volunteer physicians that work at Casa de Salud. Casa de Salud opened its doors unofficially on January the 18th, and has the grand opening this Friday at 11:30. You're all welcome to come. I think it's going to be a great event. Before I tell you some of the people who are going to be there, I must mention that this is obviously received the strong support of Dr. Father Biondi from St. Louis University, besides Bob Fox, and also from the leaders of other healthcare systems here, including BJC, Washington University, St. John Healthcare System, etc., or Mercy System. So I think we are interested in obviously providing the care to this as an episodic thing. We're not interested in providing long-term care, although that could be available if necessary. We are targeting the Hispanic community, similarly to what Grace Hill and the other healthcare centers provide, which are obviously uninsured or underinsured. There is a fee similar to what was mentioned that we have that is very low, it's $20, but we don't turn anybody away because they cannot support that small coverage. So far we are seeing, and Stephanie O'Donnell, who's here and is the main person there, along with Mary Lavin, told me that we're up to about 70 patients a week. So despite the fact that we haven't had an official opening, I think that has been very good. This opening this Friday is going to be, Father Biondi will be there, Mayor Clay, Sarah McCaskill, Lacey Clay, and Mayor Slay, and I think it's going to be a great event. There's going to be a mariachi band, some food, some tents, by the local Hispanic restaurants will provide the food, so I cordially invite.
Mexico coming too.
Sorry? Yes.
Mr.
That's
Jacob
Bravo.
So I think it's going to be a great event, and I think the facilities are very, very, very good. They've done a wonderful job. Father Biondi and San Luis University donated the space for this initiative, and I think we're looking forward to increasing the doors, to opening the doors to all immigrants, especially Hispanics. It's not limited to Hispanics, but obviously we're targeting that population. We have all the other services, despite besides the ones that are mentioned, that are available, and the hours are still work in progress, because again we try to fit the hours based on what the availability of the volunteer physicians and services are. We have spiritual counseling also. Father Ricardo has spends time there helping people that are looking for spiritual help. So I think this is an initiative that I think is not a competitor to the federally qualified health centers, but hopefully it will be an addition and an entry point to those Hispanics that may not initially go straight to Grace Hill or some of the other healthcare centers in the region. And I'll stop there.
Okay, it's great. Now, you have heard 3 agencies or institutions that provide services to the immigrants, the undocumented, etc. There is a perception, as I recall, that there were no services available for people that did not have a medical plan. The objective of this evening was actually to change that perception. That doesn't mean that those that do not have a medical plan are not seeking medical assistance through these agencies. So that's the reason why we brought them forth. But now, obviously the questions will tell us, why do they 3 exist? Why 3? 2 federally funded, 1 that is not yet there, maybe not on purpose. Why do they exist? Why are they not under one umbrella? That would be a question. Second question would be, what kind of a collaboration exists between them? Because I recall going to Casa de Salud, and I had a toothache, and then Casa de Salud made an arrangement with Grace Hill, so I could go out there and get my pain relieved. And by the way, I don't have any medical plan. Maybe you qualify for Medicaid. So those kinds of things exist, but I want to see what other things exist in your mind, and maybe Nina can also cover, that within our community are not being served, and they should be served. Is it a matter of publicity, marketing, fear, not knowing, or lazy? What are the questions that we need to raise to these 3 great panelists? The floor is open. Whoever has a question, raise your hand and I'll kind of bring it forth. Don't be quiet, but get it. Okay, Nadia.
Okay, I also wanted to add, I work in outreach and I go to each of these wonderful places to work, and I talk to the people and they love these places. They have Bosnian speaking people, they have people that speak Farsi, different languages. They accept everybody from Africa to different places, and I love these centers. They are wonderful, wonderful staff that treat the patients with respect, and they need insurance. They have the kids that are born in the United States, but the parents cannot qualify, but the kids, they are sent to a specialist that can help them fill out the application in Spanish, and they are very wonderful places, and I encourage everybody to go visit them because they help us so much. And I'm so proud that we are now opening the Casa de Salud, and I'm going to be trying to work with them too. So if you have any questions, let them know. They will answer them.
Preguntas. If you do not know English, we'll ask Idalia to translate. Questions? Questions? Eileen.
I'll ask one. With the controversy that exists about immigrants that are undocumented, have any of you thus far experienced any negativity as a result of offering services to individuals that are undocumented?
I haven't seen any direct
No, I haven't.
negative
No.
impact.
No, I think the main thing, I think the answer is, at least in CASA, we haven't seen that, but the opposite, which I think all of you are aware of that, and I think Mr. Massey mentioned that, Dr. Massey mentioned that, is the fact that is the perception of the patient that are they walking into, and we have had that experience even in our short time that we haven't officially opened. It's been an unofficial opening in which people are afraid to tell you how to get a hold of them, or not give you the wrong phone number and that. But it's strictly that fear, am I going to get caught? Am I going to get, are they going to call the feds on me, the immigration on me? But I think that's the thing that we need to take out to that community, that's not what we're doing, that we're there to worry about their health and health prevention, nutritional education, and all sorts of the things that are good for them and their families.
But take on her, just a moment, just to complete this, take on her question about how the general population perceive those centers in terms of what we all know that is a group of people, the general population, that are anti-immigrants, and they might be feeling why this center is offering if we want these people to go away, and how this community, this general population, if they have done anything. So far to CASA, nothing. It's too new, right?
It's too new, but I think we intend to just send the message out. I mean, we have to be careful how that message is sent, but I think a lot of the things is a matter of I think, from a physician's point of view, is the trust that the patients can get on you, and the word of mouth, how it gets passed to other people, that they believe, start trusting that as a place where they can go and receive their answer to all of their health questions or prevention.
Question. If I need to follow up, you see a patient goes in, you determine that he or she needs further review by another specialty, what happens? Go ahead, Robert.
You're asking one of us, or?
Yeah, anyone, whomever wants to answer.
Sure.
Go ahead.
Okay. Well, it depends, because I'm thinking about what you do, and then I'm thinking about what we do at Grace Hill and Family Care. And certainly, if a patient comes for the first time, we schedule an appointment for them to follow up if it's a primary care issue that requires that sort of follow up. And we do a lot of things like, making phone calls, making sure that they get reminder of their appointments, and in some cases even a home visit. But if they need to be followed by a specialist, then we work primarily through Connect Care, Singles Connect Care, because we have an agreement with Singles Connect Care that it comes under the umbrella, let's say that way, of an agreement we worked out through the Regional Health Commission. You may add details if needed. But basically, we have an agreement, and it's been a long-standing agreement to make those referrals, and let's call it a voucher system. So if the person can't pay the full charge, they'll pay on a sliding fee when they go to Connect Care for those specialty services.
So there is the initial fee, $15, $20, $25. Then I'm going to see the neurologist, and the neurologist fee are on a scale. So I'm going to see the picture.
Yeah.
I am one of those patients, had not seen a doctor in years, don't have any documents. I heard about CASA, Family Care, and Grace Hill. I'm fearful I go there because what I have may be expensive. You see me, the treatment is fantastic, but you need to see somebody else. That adds up to the money that I don't have. What is my expectation? That's what I see. The mindset of that person, what do they need to do? Because I need to project, market it. And in order to market this idea, I need to make sure that the picture is complete and it's not partial. Primary care is in, you don't have any, you have this medication and boom. So what happens in that case? Because I have another follow-up question regarding medication. Go ahead.
Well, I don't know the sliding fee scale, where it starts and what fees they have at Connect Care.
So I don't have any money. What happens?
Well, at Grace Hill, you are assessed on the sliding fee. Our starts at $10. But if you don't have any money at that time, we'll still see you if it's urgent. If you can be seen at a later time, you're just there for, you know, just a routine visit, we'll reschedule you for maybe the following week or whatever, when maybe you tell us, well, I get paid next week and I can't pay you today. That's fine, and we'll reschedule you for the day you can bring the $10. And if you still can't, then we do have a way to work that up so that people might come up, you know, up to 5 times, say, where it accumulates up to $50. But we expect a little bit of payment, even if it's, you know, a couple dollars, at some point in time during that process. Now, when it comes time for that referral to Connect Care, you know, it really becomes part of their system. And since we don't have a representative here, I really can't tell you
Okay.
what sliding fee is, but it's low. I know it's a
Yeah,
low.
I can Connect Care does provide specialty care services on a sliding fee that's very similar to ours. Now, I'm like Yvonne, I can't quote it exactly. I know a number of people who are uninsured who've gone through the Connect Care system and had hospitalization, surgery, specialty treatments, and they've done it without accruing a large bill. Actually, in some cases they didn't pay anything for it. One thing that's important is that access to specialty care is only for people who reside in St. Louis City or St. Louis County. It's an important point because we serve people that go beyond that, and when they need access to specialty care, it's not Connect Care's decision, and the funding that supports Connect Care prevents them from going beyond that. So that's an important point.
So what happened to that person?
Right now, we depend on the kindness of specialists who our doctors know, who they will call the specialist
Correct.
and say, I have a patient who has no insurance, who needs to have an
So
EKG.
you have a network of
Yes.
individuals that provide.
And it's fragile. It's got its
Yeah,
limits.
it's fragile,
Yes,
very fragile.
it's,
I think, you know, let me just address it from our other side because I've run into this for many years. Major hospital centers here, training centers, hospitals, so mainly St. Louis U and Washington University, although there are other hospitals that have primary care or internal medicine training care, had what they were known as ward budgets for the indigent. Those have disappeared. And so the physician fee, I've never found a surgery that is turned away from any surgeon at my institution in the 36 years that I've been practicing there. But what gets a little complicated, and I can't go into all the detail because I don't know them, because it's change and it's a moving target, is how does the hospital go after that money? And it is based on the ability for them to pay and how much can they pay and that, but that always becomes a real sticky issue on the hospital fee, but not the physician's fee.
Question on medication. I'm going to address you. What happens with the medication? Is it free? Is it also costing, or what? What happens?
Who's that for me?
Yeah, either one.
Yeah. Well, I can comment on it, and maybe Stephanie can jump in. We don't have in the CASA right now, and have decided not to have a stock there of most of the medicine. I think we have very little stock.
We actually have nothing for
Yeah.
the reason that our goal is not to replicate services that are being offered elsewhere, and Grace Hill and Family Care have excellent pharmacy capacity, and so we're not providing primary care, so we don't have continuity of care, so it's more appropriate for the primary care physician in many cases to be the one who's prescribing most medications. So they have excellent pharmacy services, so we don't have those.
Those are free, or do they have to pay?
Sliding fee, we have
A
sliding
sliding
fees
fee, okay,
again.
good.
And again, sometimes depending on the situation, we're able to help patients sign up for direct assistance from pharmaceutical companies. But it depends. Their requirements vary very widely from pharmaceutical companies.
Questions of it?
Although
Sir.
now just to follow up on that, there is still, although it doesn't solve all the problem, the fact that through Walgreens or some of these places, you can get a lot of medicines very cheap, generic medicines very, very inexpensive.
Antibiotics are free, I
Yeah.
believe, as
Yeah.
well now. So.
I hope I have an easy question and then probably a naive question. The easy question is, what percentage of the patients that you see are of Hispanic origin? That should be hopefully an easy one. And then secondly, how does the new healthcare reform really affect the services that you will provide or that you provide currently? How will the changes in the legislation and the laws will affect the services that you provide to the
We found out that it's not needed. I mean, the services have been provided. Healthcare was not needed. Go ahead. Answer. Yeah. How many? What's the percentage of Hispanics?
Start with Bob.
About 7%, 7 to 8%. And that has increased quite a bit because when La Clinica closed. So there was a number of patients. We worked very closely with La Clinica staff to refer patients to the health center. So our percentage went up quite a bit in the last 9 months. Healthcare reform. I think a couple of things. One, community health center, I think you're going to see expansion of community health centers, whether that's new buildings with more doctors and more staff. So the difference is that healthcare reform is going to increase access to lots of people, not just underserved people. It's going to require that 98% of all Americans get healthcare insurance. So not only is there going to be increased demand among people who are low income and will qualify for Medicaid, you're also going to have middle class people who will be required to buy insurance, and they're going to be wanting to access health care. So I think you're going to see a great demand, increased demand in all of our communities. So I think what you'll see at the health centers is growth. You'll see new buildings, you'll see additional staff. So those are the kind of things we're working on right now at Family Care, strategic planning to look at where we would place those centers. How in the world are we going to find all those doctors and nurses? Because
That's the key.
That's key. So I think that's what you'll see. I will put in one plug, advocacy plug, is one of my biggest concerns is that if the federal government allows each state to decide whether they want to expand Medicaid, we need advocacy with our elected officials, and we need to elect the right people. We need to elect people who will go to Jefferson City, who will support expansion of those Medicaid dollars, to accept the federal match, take money from Missouri, put it together, and cover more people. If not, I don't see us accomplishing a lot, especially with that population of people. So that's my soapbox. Thank you.
All right. At Grace Hill, we, if you look at percentages, also about 7 to 8%. We have more centers, so we serve larger numbers. So we serve about 3,800, I think, people who are in our system selected as Latino or Hispanic origin, and it has increased, the same as what Bob stated. Also, I guess I wanted to point out, in case some people here don't know, that women who are pregnant qualify for temporary Medicaid, and that is regardless of their citizenship, residency, legal, not legal status, any of that. So Medicaid does apply for some of the patients directly that we see, and then when babies are born, if they're born in this country again, then they qualify also for Medicaid. And some people have lived here for a number of years. They have been fearful to apply because they think that they need to give information about themselves that might put them at risk, and that is not the case. So that is protected, and so they don't need to apply for themselves. They can apply for just the child. So in whichever measure that all of you here can help get the word out in regard to services that all of us provide, CASA refers to people, as they say, they have become a stronghold for an entry point for people that perhaps hear a name in Spanish are a little bit more likely to go through that door first, but then need comprehensive services they'll get from one of us. And then also that word that we are, a friendly place to immigrants, that we understand that are sensitive to their needs, and that we have resources in their language to serve them. So that would be great.
Dr. Support?
Yeah, I think CASA, again, is relatively early. We've been with doors opening, a fairly short time. I think we have primarily a Hispanic community that's coming through our doors, but then, like it was mentioned, it's an entry point, and then they will end up in the other federally qualified health center. I do have to get into a soap opera for 1 second here. I see the healthcare issue, and I think Dr. Massey addressed that, as are we going to have doctors to take care of patients? I think that the field that's going to grow in this country based on the projections of how this may play out, is the nursing, the nurse practitioner, physician's assistant field. Because I think physicians, right now, there is a thing that keeps getting passed, the can keeps getting kicked down the road, which is the Medicare bill to pay physicians. As of now, any doctor that takes care of a Medicare patient will get a 21.5% reduction. That by itself, it doesn't affect as much, and it may not have as much an impact into specialists that generate per event a considerable larger sum of money, but it will affect the primary care physicians. They're not going to go into primary care because at that level, if you cut 21.5%, they're going to lose money seeing Medicare patients. So we're seeing already in the city of San Luis a lot of groups of internists and primary care physicians that are surveying their patients for boutique practices. Okay? So I really think that that's where the challenge is going to be. Are there going to be enough doctors to take care of this? And I predict that it's not only the healthcare centers that are going to be really grow in number of patients, but the emergency rooms, which theoretically this bill is supposed to decrease that, because rather than if you don't have a doctor, you go to an emergency room and they'll take care of you. Well, I think that this may even increase the number of visits to emergency rooms. So I really, you know, again, in my soapbox, I think we need to not only push for our local, you know, Jefferson City, but our representative to the Congress, to that, you know, they really need to look at this carefully and figure out ways of attracting, because once you have physicians in the field, they will take care of patients for nothing. I mean, a physician would rather do that as in front because of their altruism than look at a way of saying that across the board I'm going to get hit for 21.5%, and then there's going to be another 5% the following year. That's going to have a significant impact.
We're going to have a follow-up panel with that topic because it's important. Lieutenant Muxo, you had a question.
Well, you asked the question and I answered. Basically what I wanted to know, because I had to wrap my head around this, was how do I market it to my people with if a person, you know, I don't have any money, I go there. Each one of you have a, what's the difference between the federal provided one as opposed to Casa del Salud? What services that are different that you provide as opposed to the Casa?
Primary and no primary.
Right, I mean, I may speak.
Well, no, I think we serve as an entry point. It's episodic, it's the initial contact, and the fact that we have, you know, we have all the services in terms of providing translation if those people that, if the physician doesn't speak the Spanish, although a lot of our physicians have either a Hispanic background or speak, you know, Spanish, that can be, but we have those services. And then the navigator, in other words, we make the contact with the federally qualified health centers and refer those patients, and then navigate them there, take them there, try to make sure that they're, and then do some sort of follow-up to make sure that that is happening. But our intent is not to do long-term care, which is what Grace Hill and the other healthcare centers provide.
That answers it. Thank you very much.
Two more questions, Rose.
Yeah. Do you find that people, immigrants, are afraid to go to the hospital for the same reasons that people are afraid to go to the health centers because of their status? Or what, do you know how that's being handled? Hospitals?
Well, I would imagine if it's an emergency, people go, no matter what. Just sort of how if somebody has severe toothache and an abscess, they'll come see the dentist, even if they've never gone to one ever. So I think those cases, you know, that people do go, but if what they're looking for is something they think they can self-medicate, it's certainly a very negative thing, you know, because they'll probably get themselves into more trouble or escalate their disease entity. So, I mean, I can't really speak for the hospitals, but I would suspect some people do avoid it. It depends on this. When they get to that level, they're more severe, though. So.
One more question back there, Daniel.
Yeah, I'm in Illinois. I'm pretty involved with the Hispanic community over there. You know, are the services from the Illinois residents, you know, immigrants, are are your services available to them, or do you have a counterpart over there in Illinois?
We do have a counterpart there, Southern Illinois Healthcare Foundation. It's a really, really big federally qualified health center. I think they even own a hospital.
Yes.
They have a number of sites in the area. Yeah.
And Casa de Salud?
Yeah, I think we
They
will
provided,
accept-
actually, they don't ask you where
Yeah,
you're
we
from.
will accept patients that are outside of the San Luis area.
But we've also developed relationships like we have with Grace Hill and Family Care with other providers on the Illinois side so that we can connect people close to their homes.
And the last question, because I know she has her hand.
Thank you very much. Can this center be used as a walk-in clinic, or do the patient have to call prior making an appointment?
Good question.
Well, at Grace Hill, we just started a same-day service at one of our locations, and it's currently located, it's on the north side. It's at 2524 Hadley Street, 63106. I'm sorry, it's the zip code. But other than that, people really do need to call ahead. If they have a need for same-day care, they can call that day, and if we can work them into the schedule that day, thank you, then we do. But if it's a urgent care need, we might refer them to an urgent care center. If it's an acute need and we don't have access, we might call upon CASA, for example, and say, we have somebody here with an acute need, we're booked up today, coming tomorrow is not really an option for them for whatever reason. Normally, if that's that acute, we will send them to an urgent care center, however, if they can't wait till the next day. So that's, I don't know what.
Well, I certainly thank the panel for bringing, I think, great information to us. It's obvious that we have to market what the services they're providing so that no one can complain about not having the facilities to have a medical services provided. So we thank you again, Dr. Sicard, Yvonne, and Dr. Massey for spending some time with us this evening. We will be inviting you back so that we can have a soap opera much greater. So we can talk about the actual reform, because obviously that's a great topic for us. We didn't want to bring it up tonight. Thank you. Go ahead.
I have one more point. The boards of the federally qualified health centers are composed of a number of patients. We have to have 51% by federal law. And the rest of the people are on our boards. We look to people who have financial expertise or have expertise in the medical field or in public relations. One of the areas, at least at our health center, that we have a very hard time are to get board members who represent the Hispanic community or the Vietnamese community or the Bosnian communities that we serve, who often have barriers related to either language or maybe immigrant refugee barrier issues. So if any of you are interested, I'm going to leave my information, and certainly please feel free to contact me, because our board would really like to get some board members who could represent the Hispanic community and therefore bring these kinds of needs that you've identified tonight to our board so that our organization can strategically meet those needs. And we would value that, and we appreciate your help in helping us achieve that.
Gracias.
I'm sorry,
Yeah.
I wanted to add one more thing. I invited also JFK and People Health Center to come, but unfortunately they couldn't come. But they have the same, they offer the same benefits to all our community. So in the West is, Mercy. So if you guys want to go over there also, they accept Hispanic people.
We're going to put all that information on the website so you'll have direct contact with them. Thank you very much.
Thank you. So before we finish tonight, there are a few things. We have here 25 people who signed up, and I think we have more than 25 here tonight. It's very important to have your information, even if you don't want to put your email, which would be good so you can receive our newsletter. Because in our auditing and we need to count how many people attend our meetings. Is it being helpful? So the attendance is one of the documents that we count. So I will pass again the form, and those who didn't have a chance to sign, I ask you to sign. Another thing is we as a Hispanic Leaders Group, we have several projects that we have underway. One of our main projects is the scholarship that is coming soon, and we are looking for sponsors and help with other corporations that can help the Hispanic Leaders Group to provide scholarship to dedicated Hispanic youth, which they are the future of our economy. We have the privilege here tonight to have some of the recipients like Mario, and I don't know if there is any other student who has received, and they here tonight, but they appreciate and they can continue their studies. And those organizations that are being represented here tonight, please consider in being part of that contribution for the scholarship. Another thing is we are looking for interns. There are several projects, like I said, we have underway, including the Latino Legacy Project, which takes hours and hours of preparation. So we would much appreciate those who have interest to work with the Hispanic Leaders Group into this project and the others that we have throughout the year. If you know students or others that would be interested to work with us, please let me know. And before I open the space for each one of you to introduce yourselves, those who are not members of the Hispanic Leaders Group, what does that mean? We don't have too much expenses, but we do provide a lot, and we need to cover those expenses. So we have a membership of $15. It's an annual membership, and for 2010, I think there are just very few, 4 or 5 who have already paid the membership for 2010. Those who are not members and would like to apply for membership, there is an application form that I will have here on the desk, on the table, and I encourage each one of you to consider to join. As an individual, it's $15, and as a corporation or organization, it's $25. So it's not too much, but that money helps us to continue to offer you educational meetings like this, as well as other services that we provide throughout the year. So those are the things I would really ask you to consider, and I really thank you for your support tonight. Our next meeting is June, so we meet every other month, and I think
June 9.
It's June 9th. It is the second Wednesday of each either month. And like Jaime said earlier, it's going to be also here at Brown Shoe at a bigger conference room, and I hope I see you all in June. And now I open for each one of you to introduce yourself and tell a little bit what's going on with your organization and why you're here tonight.
Let's start from here because we already met this people here. Go ahead, Jorge.
Well, my name is Jorge Soriano. I'm with National City, soon to be PNC. And I am also, if you don't mind, I'd like to say this, I'm also a very proud future sailor in the United States Navy.
Although he needed to go to the Air Force, but. Elizabeth?
I'm Elizabeth Soriano, and I'm owner of a company called Philanthroping. We help create consistent streams of income for nonprofits, churches, and schools. And I just incorporated a foundation, Isabel 321. I have a daughter who has Down syndrome. So, and that's to target immigrant and minority families that don't speak English, to help them learn advocacy in their own language, to navigate through the cumbersome systems, to help their children live an all-inclusive life, and to also help their kids with their culture.
I'm Cheryl Rose. I work for the Missouri Commission on Human Rights. We enforce the state's anti-discrimination laws, and that include employment, housing, and places of public accommodations, and that does include discrimination on the basis of national origin and ancestry. And I also am on the board of the Multicultural Task Force, which is a volunteer organization, and we give diversity education grants to teachers for projects and programs in their schools that promote diversity. Because teachers really don't get very much support for that kind of, those kinds of things.
Let me go back here first, cover some other good.
Anne Ryan Nearson, currently of the International Institute, but retiring in 2 weeks and 3 days.
But not counting, you can tell she's smiling.
Yeah. No, I love the Institute, but I've been at the Institute 30 years, but I've been working with the Hispanic community for 40 and look forward to another at least 10 or 15 years more. So I'll be around.
Carmen?
Maybe 20, maybe 30.
I wasn't intended to be introduced really, but
Well, you are.
I'm Carmen Dens, and I'm also a researcher at Washington University, and I had the privilege to have met Dr. Sikar many, many years ago while we were involved with some common issues, and I'm here as an observer and learning more of all the alternatives and wonderful aspects related to healthcare as I am again part of the University Medical Center.
And she's also the leader of the Grupo Atlántico. And if you go Monday, the University of Missouri at the J.C. Penney Auditorium.
Yes, we have a really wonderful program coming to for the community. We have made that Spanish or Espanol at the center is part of the Center for the Humanities, and schools are going to bring all the kids that are learning Spanish to have the whole morning at the university, and at the end 12:30 to 12:15 to 1:30, then we are going to offer a program, an entertaining program, a performance in which we are trying to bring the variety of cultures that we are also proud to be uniquely representing. So I invite you, anyone, any educator that you know that has students, or you yourself had the time to go, you will see part of this program then.
She's always recruiting dancers for the group.
I'm Suzanne Lamar, and I am also with the International Institute.
But not leaving.
But not leaving, that's right. I'm sure you all know about the Institute in terms of all of the services that we have. The other thing that I will pass around is just a flyer to remind you of Festival of Nations that comes in August. And of course, we really rely on ethnic community support. This way around, you'll get the flyer, and then the edition here, you'll need to take one of those, because with Anne retiring, we've got to make a few changes, and that didn't get onto the flyer. So hopefully you will contact us if there's a way that you want to get involved in Festival of Nations.
Thank you.
My name is James Chiriboga, and I am a Spanish interpreter. I am representing LAMP today. Many of you have heard of LAMP already. It stands for Language Access Metro Project, which is an agency of the Catholic Family Services. So we give interpreting services to the whole of the St. Louis area, and we are continually capacitating interpreters. We have interpreters for the legal section, we have interpreters for the medical section, and we are currently with interpreters for mental health as well, continually capacitating them. I'm going to pass some cards around. Feel free to take as many as you want and distribute them amongst the Spanish community. So we're here for the Spanish community as well.
Gracias.
Services, pretty much prepaid legal services, specializes in affordable legal plans for the entire family, as well as identity theft protection. Next month in May, I'm going to be on a panel discussion in conjunction with the Hispanic Chamber of Commerce, as well as with FBI agents, and we're going to be discussing identity theft as it relates to Hispanic-owned business owners, etc.
You already met Daniel?
You're skipping me?
Of course I am, but not her.
No, can I make a plug real quick? Okay, cool. So this little phone is something that KTC is giving to people in the community. Anybody can go and do it. And there's a Hispanic legacy project that we are involved in, but they want the community to go borrow one of these things for a couple of weeks and then do programming. And then people like Dinora and Joe are taking an editing class that after all this footage is taken, they download it and they make videos, and they're going to post them on a new website that's going to be launched this summer. So if you want more information, you can contact Kate Shaw at KETC.
Great commercial.
Kate Shaw. Yeah, very, very cool program. They even give you a little tripod. Okay, I'm done.
Well, my name is Angela Rey, and I'm here just as an observer. Just wanted to learn more about the Hispanic Leaders Group, and the meetings, you know, very, very helpful. So, thank you very much. Gracias.
I'm Bill Ash. I'm the president of the St. Louis Classical Guitar Society.
He didn't come with his guitar, you noticed.
Next time I'll bring it, okay? For the reception, I'll put it. But guitar music is so well known in all Hispanic cultures, and so I know that you're all familiar with guitar. We primarily support classical guitar, but we also have flamenco guitarists, and almost all of our programs have Hispanic music. Almost everyone plays something from Hispanic country. So we're having a members event on May 16th. I've got some flyers, and you can go to our website and get our emails if you'd like. But I really came because I'd like to let all of you know that we're here, and a lot of what we do for our programming is Hispanic in nature. And so I'm a big fan of it, and you'd be surprised that people who are not of Hispanic background like Hispanic music just as much as you do, if we can just get them there. so that's my question.
Are beautiful. They really represent the best of the Latino music in general and worldwide music.
So feel free to take one of these, and you can go to our website, get our emails, or this is May 16th, and we welcome you to come. I actually have a guitar orchestra that is going to play, so I'll pass these around. Thank you.
Thank you.
I'm Kathy Sicard, and I'm an observer, and I just came to listen to my husband.
Bodyguard. The bodyguard.
The bodyguard.
She handles all the money, too. Thank you. Mario?
Hello, my name is Mario Santander. As Celia mentioned, I was one of last year's scholarship recipients. I'm a graduate student at Webster University. I also work as a graduate assistant for Webster, the School of Business and Technology. And I'll be graduating in the summer with my MBA.
Now, you're going to invite them to present, right? Mario is inviting you to Salsa con Salsa, which is an event that is set up once a year with San Luis Potosí and St. Louis, Missouri. It's a sister city, the Friendship Committee. And once a year, they selected this year to do the Salsa con Salsa at Club Dantes. Salsa, because there will be a competition of your personal salsa. You mix your own thing. And then there will be instruction of salsa, not the one you mix, but the one you dance. So you're welcome. That will be May 7th from 8 through 10 o'clock at Club Dantes. And Mario is leading that effort. Maria?
Hello. Teresa Maldonado. I was basically very much involved with the Hispanic leaders, and I still do that. And I'm involved with Casa de Salud, and I just wanted to echo what Dr. Sitar said. I wanted to let you know that, and this is a very personal thing, but at the same time, I think it's important as a consumer. I think we have many, many, many services. You know, our country has been blessed with so many things that we have to offer. But the key is outreach. The key is outreach. And I think that when we see the federal qualified centers and the many other hospitals and all of the things that we have, they don't do us too much good in terms of the information being contained. We have to make sure that all of us here just spread that word. And I think for Casa, which is something that came from the legacy of La Clínica, but also came with a big push from the Hispanic leaders to rally the community and support it, the difference is going to be all of us here being involved. People like Mike Muxo, who is now in our advisory community, and he's looking at how the police could be trained, sensitized, and basically seen and perceived as an assistance, you know what I'm saying? Not as the immigration enforcers. Those are the things that I think CASA will do and will do well. And those are the things that hopefully will be the launching pad so we can access all of the other services. So I think that we have a tremendous amount of work to do. The services are there, we have to connect the dots. And that's what CASA is going to do.
Next, thank you.
I'm Karen Oresti with the Anti-Defamation League. I'm here tonight to specifically request and follow up on some of the comments that were made earlier around the issue of fear. One of the things we do is staff the U.S. Attorney's Hate Crimes Task Force. I would like to formally request a representative from the Hispanic Leaders Group serve on that task force. I think one of the issues that's key, and Lieutenant's certainly familiar with this, is the issue of creating a community that understands that there is safety and security in reporting hate crime, in bias incidents, in going to health centers when you need care, in having trust and faith in the community services that are many and varied. So if I can make that formal request, the next meeting of the task force is June 4th. And anybody knows to contact me and knows where to find me.
Send an email.
I will send an email and we'll make a formal request. It's Karen Oresti.
My name is Malik Ahmed. I am the CEO and founder of Better Family Life. And I was invited here by Carmen Pence, and I'm very grateful that she invited me. Better Family Life has always sought to create alliances with the Hispanic community. Better Family Life is a 27-year-old holistic community development corporation that does so many wonderful things in the community, but of particular interest to the Hispanic community, I believe, is our housing counseling program. Our housing counseling program is, it does two things that is quite unique. It helps first-time homeowners with financial assistance up to $3,000 in the county and some dollars in the city. But also, Better Family Life has been one of the leading agencies fighting predatory lending. And predatory lending and foreclosure counseling has hit the Hispanic community quite seriously. And so we urge you to send some of your constituents to the Better Family Life so that we could help them save their homes. We've been able to negotiate with some of the lenders, and sometimes they use fear tactics, but we've been able to mitigate some of those things and make sure that people stay in the home. If they're not too far gone with their mortgage, sometimes, as I said, we can provide assistance. On the other hand, Better Family Life on the TANF side is one of the largest TANF providers of job training and placement. If you have clients that's on TANF, certainly they are eligible to come through our training at the Met Center in Wellston. We also have youth programs and some other kinds of programs. As it goes around, my wife, so she's back there.
Deborah is back there. Yeah.
She has another side of the organization that she would talk about. But I urge you to look up Better Family Life. It's on the web, betterfamilylife.org. I do have a few cards, and any way that we could create a stronger alliance between the Hispanic Leaders Organization and Better Family Life, we want to do that because we have services that will be very beneficial to
what
the
we'll
community.
do is we're going to put your link in our website.
Very
we
good.
need to do that, certainly. That's great service that you're providing. Thank you for coming tonight.
You're welcome.
Thank you, Carmen, for inviting us.
10 to 15 years, about 60% will be eligible. So that's one of the things, you don't just wait until it happens and then try to hire people in. So we're trying to find out where we would find this replacement talent. A lot of it will require technical skills. So those going into the engineering fields, those who are good at working with their hands, are interested in climbing poles and being out in all kinds of weather.
Making good money.
Making very good money. There's opportunity around the corner. So we'll be making ourselves seen, and personally I will make myself seen here. This is something that's dear to my heart personally.
Thank you.
Hi, I'm Roxanne Miller, and I am with University of Missouri Extension here in St. Louis County. And the reason I'm here is I wanted to just, I've been coming to some of your meetings over the last several years, and University of Missouri Extension actually exists throughout the state and each county, and our local office is here in Clayton, just down the street in one of the county buildings. But we do outreach in the community and actually bring the resources of the University of Missouri to the people in the community. So I just wanted you to be aware that we are always available to partner with organizations, and I have a number of business cards. I'm not sure if I have enough for everyone. If you want to just go ahead and take one if you're interested. But I do want to specifically say that as far as some of our programming, we have nutrition and health education. And University of Missouri Extension has been expanding over the last several years with all of the, really the needs, especially with health education and how it's related to nutrition. So we do have some programs related to diabetes that we partner with some of the healthcare organizations actually to provide information for people. It's meant to be a supplement for people to come and to be able to learn ways that they can manage their diabetes. And we also have a number of other programs related to financial education, as I said, nutrition, business development, 4-H youth development. And University of Missouri, as a number of organizations, are faced with a number of budget issues, and we're waiting to see how the state, resolves that. But we do partner with organizations, and we need to be able to recover some costs for travel and so forth. But we are always, especially working with underserved populations and trying to partner with organizations. So just want to make you aware of that our specialists are available to talk with anyone. If you have a particular need or concern in your particular community, we can work with you to be able to see if there's some way that we can collaborate and offer some services to your people in your community.
Thank you. Lenny?
I'm Lenny Frankel. I'm here representing the Jewish Community Relations Council, and we are always looking to collaborate with Hispanic organizations on matters of common interest.
Thank you.
Good evening. My name is Father J.C. Kane. I'm Director of Hispanic Ministry at Our Lady of the Snow Shrine in Belleville, Illinois. This is my first time to be here. So, and the reason I'm here is just to learn what services are available, what is the constituency of the Hispanic community in the area. I hope to build some bridges. And so in whatever way I can collaborate as Director of Hispanic Ministry there at the Snows, or anything that we can do maybe that we could be of service, that's what we're here for.
Bienvenido, Padre.
Gracias.
I'm Daniel Davila. I'm with the U.S. Department of Labor as a wage and hour investigator. And what we do, we enforce the Fair Labor Standards Act, so and the Family Medical Leave Act and other federal acts. So I got some cards. We also do a lot of outreach. There's a new campaign that the Secretary of Labor just started the 1st of April. Is We Can Help, or Podemos Ayudar, and I'd like to partner up with any organizations.
Thank you. Eileen?
I'm Eileen Wolfington. I am a Community Development Specialist with the Federal Reserve Bank of St. Louis till the end of this month. And then I'm going to do something else, and I'll announce that later. I'm also one of the co-facilitators for the local Professional Latino Action Network, or PLAN, for those of you who haven't attended one of our meetings. This year we'll be celebrating 6 years, believe it or not. And my colleague had to leave, but there was a representative here from United Way earlier who is looking to recruit Latinos to be part of their allocations panel. They have about 16 different allocations in many areas, and it would be wonderful if a couple of us could be on those allocation panels to see where the money goes in our community. United Way funds over 100 agencies, maybe one or two of you in this room, and it would be great to see some new faces on those panels. So I will send the information to Silea so that she can put it on the HLG website, and hopefully one of you can be there.
Gracias. Ernesto?
My name is Ernesto Gutierrez. I am with the Mexican Cultural Institute of Mid-America. I am also a physician who has a practice in the North County and do attend of a lot of Hispanic patients, which is interesting in a way.
Gracias.
Hi, I'm Deborah. I'm all in the back. I'm Deborah Ahmed. I'm also with Better Family Life. I'm Senior Vice President there at the Cultural Programs. And I would just like to invite all of you all to our upcoming Black Dance USA Celebration and Movement. I, of course, am also here per Carmen Dentz's invitation. Black Dance USA is a national dance festival that we do every year, and this year is May 26th through the 30th. We're about to celebrate 25 years of doing this event, so I would just say to you all, move, sweat, live, experience it at blackdanceusa.com. Please come out, okay? Thank you. And also, we have a health program called Your Health is Your Wealth. And Jaime, I want to get with you after the meeting because I like to be in communication with the representatives of the 3 healthcare agencies. So maybe some of the services that we can extend to you all in terms of what we do, okay?
And
Thank
Deborah
you.
is a great volunteer for the Festival of Nations year after year after year.
Thank you.
Runs the show there.
My name is Leah Roth, and I'm here. Eileen invited me, so thank you. And I'm starting my private practice. I started a couple of months ago, and I'm a bilingual psychotherapist.
Oh, great.
I'm seeing along some
We need
brochures
you.
I have, and business cards. And I'm here for whatever you need me.
Announce your open house.
Yes, I have an open house on Friday, 23rd of April at 4:30, and the address is at Westport Plaza, and my office is at Westport Plaza. I thought it was easy, you know, to 17th page. Everybody knows that. So, if you're all welcome, 4:30, and the address is in.
Thank you. And is your bodyguard?
Yes.
What is your name?
Johannes.
Johannes.
Her nephew. It's her nephew.
Nephew, doing an exchange, foreign exchange.
Oh, nephew. Okay, that's great.
Good evening, I'm Silene Arauz. I am Marisol's cousin. I'm a student, graduate student from communications, and I came to see what was this meeting about. My cousin told me, and I'm so glad that I came because now I know that I want to join the group. I'm so glad that we have leaders like you in our community and other groups that are willing to help our community too. I just want to follow your steps, and I hope I can be working with you.
This is a great salsa dancer too. Before I turn over to Silea, let me. Oh, do I have somebody else back here? Oh,
We have many people.
Lieutenant Muxo, por favor.
Hi, my name is Mike Muxo. I'm the director of the St. Louis Police Academy.
Wow.
With the help of the Hispanic Leaders Group. I really do appreciate all the help.
Still a lieutenant or a captain?
Still a lieutenant. We're working on captain. But what we try to do, what I'm trying to do is I'm trying to change the approach of the police, basically. 80% of what we do is communicate. We involve ourselves with the community, and the St. Louis Police Department is the best at fighting crime. I will tell you that. We have some work to do, and we've done citizen surveys through Chief Ison, and what we need to work on is our approach with people. And so I want to try to get them at the beginning, as recruits coming out of the police academy. So I encourage all of you, if you want to get your point across, I'll bring you in as guest speakers, talk about what you do, and if it sinks into one recruit, and they can help out one family, it's well worth it.
Great.
Dinora Marito. I'm retired, and I'm the correspondence secretary for the Hispanic Leaders Group.
Rafael Barron, Hispanic Leaders Group, yes.
He works in the botanical garden with a great project, and one of these days you're gonna hear it.
And he's
Right?
the webs.
He's a website maintainer, supervisor, what's the title?
Manager.
Manager.
He is in charge of
Master.
In charge of everything. But before we go home, we want to thank Brown Shoe for hosting this event. In fact, the goodies are also provided by Brown Shoe. They're a great supporter, and they're actually providing a scholarship for the Hispanic through the Hispanic Scholarship Alliance. So there is no doubt about the fact that Brown Shoe is stepping forward and supporting our community, as we expect many of the corporations to do so. Zile?
So thank you very much, and I will stay here for a few minutes if any of you want to talk, and those who want to have information in our website, which we are still getting it adjusted, and we can put that information there. Please send the email to me or to Rafael, but maybe through me, and then I can forward to them. Thank you very much, and I look forward to see you all in June.
One more.
Also, I want to thank Joe Bamarito.
That's correct.
The
We
HLG
forgot.
historian.
Is the one behind the camera that we fail constantly. Thank you. There's food, please, clean up. We hate to take it home.